Now we've got a moderator from another of those poster sessions, this time on the incidence of cancer amongst those with diabetes. Please introduce yourself.
My name is Mariusz Dabrowski. I work at the University of Rzeszów at the medical faculty, and I work also in the outpatient diabetic clinic.
So Poland.
Poland, yes.
Very good. Welcome. Obviously, cancer incidence is greater in those with diabetes, but what were the particularly interesting posters in your session?
It is what was interesting. It was a wide range from epidemiology up to molecular mechanisms of cancer, and in fact, cancer is a cause of death in diabetes, and people with diabetes have a 25% higher risk of premature death due to cancer compared to non-diabetic population. And that's why I was interested in this problem, and I asked myself a question: why people with diabetes more often die due to cancer than non-diabetic population? And I think there are some factors associated with increased cancer risk in diabetes. First of all, it's hyperglycemia. Hyperglycemia leads to altered intracellular metabolism, and in that mechanism it can promote production of oxygen spaces, and then cause mutations, oncogenic mutations, and that's why hyperglycemia is involved in cancer incidence. Moreover, glucose is a main source of energy in cancer cells, and it was in one of posters clearly presented why cancer cells change their metabolism into so-called Warburg phenomenon. And it was hyperglycemia. Another one factor is insulin. One of the posters presented increased cancer risk in hyperinsulinemic mice, and it was very interesting because mice with hyperinsulinemia developed more so-called pan pathology in pancreatic tissue, which further leads to pancreatic cancer. Another one poster very elegantly presented the role of metformin, because metformin can be considered as an oncoprotective factor, and it was speculated that metformin works in two mechanisms. The first one is a direct mechanism on cancer cells, and the second one is indirect mechanism due to compromised glucose level and due to lowering insulin level and IGF-1 level in circulating blood. And this poster presented that metformin in fact works in the cell, directly in the cell, and stops developing of cancer in breast cancer cells. So it can be considered that then if we treat patients with diabetes, we should always use metformin and never withdraw it without contraindications to use it.
Very interesting. So what these posters show is that there are multiple elements at work in increasing.
Yes.
It's fact, not one. It's increasing cancer incidence.
No.
It's not one. It's not one magic bullet, as it were.
No, there is no magic solution in this phase, in this problem. We can try to lower blood glucose in any possible method, including insulin, because although insulin is considered to be a growth factor for cancer cells, it also lowers glucose level. So it lowers fuel for the cancer cell. We should also use drugs lowering insulin resistance, such like metformin and such like thiazolidinediones. However, the latter one have many contraindications to use. Also, there is potential for other drugs, perhaps SGLT2 inhibitors, because they lower blood glucose, they lower blood insulin. They also useful for lowering of body weight, and in that mechanism, because obesity is also a risk factor of cancer. One of posters documented that features of metabolic syndrome are associated with elevated risk of thyroid cancer, and it was mainly due to abdominal obesity. And we can conclude that inflammation associated with obesity is also a risk factor for cancer development.
So whichever way you look at it, cancer is always on the horizon.
Yes, we have to do all which is possible to lower body mass,
Yes.
to lower blood glucose, and to avoid insulin. In case of my patients, I try to avoid insulin as long as it is possible, but I don't wait in introducing insulin up to when it is too late, because it can be too late. When you get a patient who is, let's say, for 20 years treated with oral drugs, he had uncontrolled diabetes for the last 5 years, and insulin introduced in such patient can in fact accelerate cancer development. So we should introduce insulin much earlier in the natural history of type 2 diabetes.
Thank you very much indeed, and thank you for presenting that.
Thank you.
Well, more from the posters in a while.